3 days after being admitted to the hospital because of a fall from the roof of a 2-story building, a 27-year-old man is being monitored in an ICU. On arrival, the patient was somnolent and not oriented to person, place, or time. A CT scan of the head showed an epidural hemorrhage that was 45 centimeters cubed in size and a midline shift of 7 millimeters. No skull fracture was shown. Emergency surgery was performed with craniotomy and hematoma evacuation on the day of admission. Perioperatively, a bleeding vessel was identified and ligated. Post-operatively, the patient was transferred to the ICU and placed on a ventilator. His temperature is 37 degrees Celsius, pulse 67 per minute. Blood pressure is 117/78. The ventilator is set at FiO2 of 55%, tidal volume of 520 milliliters, and PEEP of 5 centimeter of water. In addition to IV administration of fluids, which of the following is the most appropriate next step in managing this patient's nutrition? Okay. So oral feeding, TPN, keep NPO, enteral feeding via NG tube, enteral feeding using percutaneous endoscopic gastrostomy tube. Okay. So, what we want to do here, let me see. Can you tell me hematoma evacuation, devolution? This was identified and ligated. Okay. Blood pressure is this. I think what we want to do is do NG tube so that the abdomen, the GI can still be active. We don't want there to be prolonged inactivity of the GI in this patient. So let's see. Yeah. So critically ill patients with an intact GI can receive short-term enteral feeding via an NG tube less than 2 to 3 weeks if there are no contraindications like bowel obstruction, intractable vomiting, or hemodynamic instability. Perfect. Enteral feeding is preferred over parenteral nutrition, and this is because it stimulates intestinal motility and prevents mucosal atrophy. As long as there is no facial trauma or basilar spur fractures, an nasogastric tube can be used for enteral feeding. When feeding patients, patients should have their backrest elevated to prevent aspiration and reduce the incidence of nosocomial pneumonia. All right.